Hey cousins, welcome to Brown Liquor and Bad Ideas.
Welcome, cousins. This episode of Brown Liquor and Bad Ideas. I'm your host, Cornell Wright, the People's Lobbyist. Welcome me, grab a quick one, and let's talk a little bit more about where we are with COVID-19. Brown Liquor and Bad Ideas is intended for the participation of responsible adults of legal drinking age who wish to engage in substantive virtual discussions and social drinking for entertainment purposes only. Brown Liquor and Bad Ideas does not advocate the abuse of alcoholic beverages. Choosing to participate in any of the drinking activities shared in the program should be made with moderation and caution and is the sole responsibility of the user. So cousins, we're approaching mid-year in 2021. We've all been exposed. We've all had the trauma associated with COVID-19 in our lives. Whether you were lucky and just had a chance to be isolated at home, consider that to be lucky. If you were unfortunate and had someone in your family pass as a result of it, and by the way, our current numbers are still 700 cousins a day in the United States are passing as a result of COVID-19. The total number now is more than 570,000 cousins, and over 3.2 million cousins have been infected by COVID and will have long-term health implications, perhaps as a result of their exposures. Those long-term health exposures are going to have impact on all of us in regards to their quality of lives, their long-term exposure, their potential loss of productivity, and the corresponding cost is going to be on the healthcare system in order to make sure those cousins get a chance to live as long as they can, as healthy as they can, and have as much fun as possible. Cousins, when we do a review on this, there's been many opportunities both in business and for health situations and pandemics. It's important for us to do who knew what when, and what did they do about that information when they got it? Because cousins, here's the story. This is not the first pandemic we've had in the world, and it's not going to be the last. And so there's going to need to be a review in order to understand what were the messages at what point in time, who was giving those messages, and how did it have impact on us so we make the right decisions going forward in regards to where we were as a result of this. Cousins, too many cousins died, and we lost every one of them. Everyone is tragic to all their cousins who passed. So what does that mean, cousins? We're continuing to fight through this thing now. A lot of cousins have been vaccinated. I've been vaccinated. I truly hope each one of you have been vaccinated. We're still being required and appropriate to wear your masks. The federal government, which I believe now is starting to give us some real solid information, and what they're saying is actually happening. They're rolling out vaccination points pretty much all across the country. That's been happening. There seems to be almost enough of them. That's great too. They're going to urban centers. They're going to small towns. They're going out to the rural areas to take care of cousins out there. They've had preachers come on TV of all denominations and faiths telling their congregations to take the vaccine and to wear their masks. All this, cousins, is our attempt on the federal government and for all of us, me and you, which is why I'm trying to support this as well, for us to get to the point that most of us, all of us have been vaccinated, or those who can. There's some categories of people who can't be. I understand people who have transplants aren't particularly able to do that, but that's another story individually identified. To keep wearing masks and to make sure that everything is fine. Kids are getting back in school. They're starting to play sports again. People are starting to be able to congregate. We still have to be vigilant though, cousins. Why? Because COVID is still here with us. And the most dramatic case of that is now with India. You may have heard on the news, and if you hadn't, don't want this to be the first time, but India is having nearly a healthcare emergency in their country. Now, India was early on one of the countries that had a really good handle on the COVID-19. And by the way, India is one of the countries that produces more vaccines and a lot of pharmaceuticals than perhaps any other country around the world. But what's happening now with India is that they're under pressure. Their entire healthcare system is under pressure because COVID has reared its head and is rampantly running through their country. As a result of a report I heard earlier today, they were talking from one of the doctors there. He asked them, well, what happened? He said, well, one of the things we did is we lifted our protocols regarding suppressing COVID-19, like social distancing, masks, and those kind of things, too soon. That sound familiar, cousins? We've gone through that in the past all last year, and now we're in the process now of doing it again, although with the support of the vaccines. But the point is we're still a little exposed because we haven't gotten to that desired position of herd immunity in which you have 70%, 80% of the entire population capable of having either vaccinations total and or having already had the disease and having built up their own natural antibodies, okay? The other thing that the fellow mentioned in India, the doctor, he said there was not enough data transparency, not enough information coming out to the cousins regarding what really is the right protocols and the right activities. Does that sound familiar? Did we get the right information at the right times? No, we didn't. We know we didn't. Those are bad ideas, cousin. No, I wasn't going to use bleach last year, all right? But so now we start looking at it, cousins. Every week, we know every day has impact on cousins passing away as a result of this. So cousins, it's not a heavy lift. We don't want to be behind the 8 ball again. We're catching up. Let's continue to catch up and get ahead of this thing. All right? Because there's so many good reasons for us to do this. One, we have to continue to work on our environment, work on suppressing COVID here, getting vaccinated, etc. The president has rolled out a number of ideas. They're talking about urban, small town, and rural distribution centers. There seems to be now enough of not only testing capabilities, but all the PPEs, as well as enough of the vaccines for everybody in the United States to get taken care of. One of the questions that's come up is what's the United States going to do in order to support India and other parts of the world? Well, cousins, I think the good idea is that the United States, since we're taking care of, it appears, regarding our supplies of these things, we then take care of and somehow be able to give, provide, donate, whatever the right choice of words are, to India, and then moving on from India to the rest of the world. That's the right thing to do. That's a good idea right there, cousins. And the reason for this, cousins, is real simple. It's humanity, cousins. Because if anything we know on our planet is that now COVID spreads around the world. And a number of years ago, I heard a fellow from Africa, and he gave a description, gave him a talk, and he said, misfortune does not discriminate. Once again, misfortune does not discriminate. Think about that in regards to COVID virus, cousins. The COVID virus does not discriminate as to who it will impact, infect, and in fact, take their life. We know, cousins, that Boris Johnson, the Prime Minister of the United Kingdom, he got COVID and survived after a rough patch. President Trump got it last year. He survived after a little lighter patch, but the point is he did have it. By the way, to my understanding, you can look it up, he got the vaccine for COVID-19 in January of 2021, so everybody get on board, right? And so as you look at that, we have the capability and know that COVID-19 doesn't care who you are. We have to continue to work on it, because we have to continue to wear our mask, maintain social distancing, get vaccinated, okay? Or vaxxed, I think is the right word that's being used, all right? And the reason for that is because it's the humane thing to do, it's the American thing to do, it has to do with morality. And by the way, it was just a couple weeks ago, cousins, that the European Union decided to let Americans, i.e. us, back to visit because of the poor way we had handled the COVID-19 last year. So once we get back on the right track, which we are, let's keep on and let's keep pressing that, and let's just suppress the vaccines, suppress the disease in order to get it to where it's a more manageable level. Unfortunately, with all of these vaccines, with all the viruses that have occurred across the planet over the last few years, none of them ever truly go away. They just get to the point that we're able to identify them quicker, have medications and treatments in order to address them, and we can suppress them quickly before they move out of a given geography. I believe if you go back and look at me, you can check me on this, cousins, that's the protocol that we have to put in place. Why? Because these are natural things that adapt, and we have to continue to be vigilant on them probably forever. But it doesn't have to be the scourge and the epidemic and the significant impact that it's had on us and the world over the last year and a half, cousins, right? So, Continue wearing your mask. Let's take care of India. Let's take care of the rest of the world. Let's take care of ourselves. Wear your mask. Get your vaccines. And let's look for that brighter day when we all sit together and have another one together outside in a great environment. Take care of yourselves. See you next week on Brown Liquor and Bad Ideas.
We are the people.